Hello, my name is Angela Gartner from Northeast Ohio Parent Magazine, and I am here with Dr. Takor from the Cleveland Clinic Children's, and we are here to talk about lead poisoning and the increased risk in the summer months. Welcome. Thank you for being with us today.
Thank you for having me.
The first thing I want to ask is, so what is lead poisoning and how can it impact any home?
Sure. So, lead poisoning is when a child ingests or inhales lead particles, and then once it gets, absorbed into the body, it can deposit in different tissues within the body, and it can affect development as a child grows older. So, we can see that this affects homes that are built before 1978 because we call that the lead paint era. It was in 1978 that lead-based paint was banned. And we can also see this in homes who have lead pipes. So if the water source is contaminated, we could see that water that kids are drinking could also have lead contamination. And so then what we see as kids get older is that they may have developmental issues. So they may have decreased IQ, they may have an increased risk of having ADHD, and then they may have GI issues, kidney issues, bone issues, just because of the lead depositing in the various tissues in their body.
Is there any lead outside of the home as well?
Absolutely. So we can actually see that there are some occupations that parents or other people in the home, the jobs that they have may expose them to lead. And if they bring those lead particles home on their clothes, in their shoes, on any other things that they bring back into the home, we can see that then that those lead particles can get transferred to the kids in the home as well. And so we can see occupational exposures. We can also see that the soil around homes can be contaminated. So when kids are playing outside, especially in the summer months, we see a big pickup in that. Kids that are playing in bare soil around the homes may be at increased risk for exposure there as well.
So, talk about the summer months. Why is the risk increase during this season?
Sure. So I mentioned that kids play outside more. And so again, if there's soil contamination, we can see that they're at increased risk for exposure just from exposure to the soil. We can also see that families are doing more renovation work on their homes in the summer months than they tend to do in the winter. And so if they are working on areas that have previously been painted with lead paint, and those paint chips or paint particles start to deteriorate, or just the dust that's created with that work starts to move around the home, we can see that kids are at increased risk for exposure there as well. And then the other thing to consider is just, in the summer months, we tend to be opening and closing our windows quite a bit more. And we know that window sills were historically painted with lead-based paint. And so as we're opening and closing those windows throughout the summer, it can actually contribute to a higher rate of deterioration of that paint. And so we can see that lead chips, or paint chips, I should say, and the dust that's created from that paint kind of starting to fall apart increases in the summer months as well. And I actually recently had a conversation around how just the drier, hotter climate in the summer can contribute to the paint becoming a little bit more brittle and breaking off a little bit more easily as well. So those are some of the reasons why we see an increased risk in the summer.
So, can you talk about how you get in contact with that, and then also some of the signs of lead poisoning?
Sure. So typically, it's in Ohio at least, one of the major contributors to lead poisoning is lead-based paint in our homes because we have a very old housing stock. Most of the homes in our rural as well as urban areas were built before 1978. So we do know that a lot of our homes are contaminated at baseline. And so then as that lead dust starts to accumulate in homes, kids are playing on the floor. The little ones especially do a lot of that hand to mouth behavior, and they tend to ingest then a lot of those little lead dust particles. And so that's how the exposure tends to happen in homes. In terms of symptoms that we might see, to be honest, when they're young and when they're actively exposed, often kids don't show us any symptoms of lead exposure. It's later that we might see those symptoms develop of learning difficulties, behavior difficulties, and some of those other conditions I mentioned, like ADHD, GI disorders, those types of things. And so that's why we do universal screening for any child that has a risk factor at the ages of 1 and 2. So that even if they don't have symptoms, if they have any risk factors, we want to know and we can address the lead in their home if they are exposed.
Is this lead poisoning just for just for kids, but is there also a risk for adults to get lead poisoning?
Absolutely. So if there's lead in the home or at work, we do see that adults can be exposed as well and may experience some of those same behavior changes and things that we mentioned for children. The difference, though, is that children's brains are actively growing, especially up until the age of 2, but we see it up until the age of 6. And so that's why we're very proactive about screening and intervening under the age of 6, but especially at that 1 and 2 year range, just because we want to be able to let the brain grow as best as it can.
How now it affects all types of homes. So, and it's just not, the older homes, but like you said, there is, things coming, could other factors, environmental factors coming inside the house. So, how can we as parents ensure that we are making sure lead's not getting in our home in the summer months and then also beyond?
Sure. So the other common sources of lead that we see in people's homes are heirloom toys and things like that that may have been painted in lead paint. So even if you live in a newer home or you live in a zip code that is not considered to be high risk, if you have those types of items in your house, they could be contributing to lead exposure for children. We also see that a lot of cosmetics, spices, herbs, ritual powders and things like that that are imported from other countries may have lead either as a basic ingredient or as a contaminant. So for a lot of immigrant homes, that is a potential source of lead that we need to consider as well.
What is the cleanup process? How can we make sure that we are cleaning up properly to that we are not having our kids exposed or ourselves to lead?
Sure. So actually, cleaning isn't too difficult. If we're able to wet mop frequently, I would recommend daily, but I know that that's difficult. So if we could even do once a week, that would be awesome. But wet mopping the areas that especially kids play in or that are near areas where we're concerned about lead paint on windowsills or door frames or things like that can help remove a lot of those lead dust particles. If we're sweeping, dry sweeping, that can actually kick up a lot of that dust and help it move around the home. So I would recommend wet mopping over dry sweeping. Another thing we could try would be a lot of our county board of health departments will have a HEPA vacuum that you can borrow to get a little bit of a deeper clean in your home. And so that will help kind of remove a lot of those lead particles all at once and get into the carpet and things like that if you have areas that might be at risk. Other things that you can consider would be, again, repainting any areas that have chipping paint if you're worried about those being sources of lead. If we're thinking about lead pipes in the home and you're worried about that, you could always run the water on cold for 1 to 2 minutes before you actually use it for ingestion or cooking, drinking. Just so that any lead that might have been leached into the water that was sitting in the pipe gets cleared before you actually drink it.
How in Ohio how prevalent is this in Ohio right now? And there's a lot of people who are saying, well, this can't happen to me. Is it something that many people are impacted by in our state?
Absolutely. So we know, as I mentioned before, that homes built before 1980 are at increased risk because that was considered the lead paint era. And if we look at Ohio, 2/3 of our housing stock, including both urban and rural areas, were built before 1980. And so we know that at least 2/3 of our homes are at risk for lead exposure. So it definitely is a problem.
And how can more people find out information from you in the Cleveland Clinic?
Sure. So you can go to the Cleveland Clinic's website, and we have some nice information there about lead exposure and ways to prevent lead exposure. You could also go to the Ohio American Academy of Pediatrics website to learn a little bit more about risks in your area and ways that you can prevent lead exposure for your children.
And I guess my last question is how important it is for parents to really understand and know about lead poisoning.
Absolutely, it's very important. So, like I mentioned before, we don't always see signs or symptoms at the time of exposure, but we see lifelong effects. And so, if we have the opportunity to intervene when a child is small, we can improve their outcomes over the course of their entire life.
Well, thank you so much for being with us today. You can also find more information on health and parenting topics at northeastohioparent.com.